So welcome. My name is Carissa Miller. I am the Program and Communication Specialist for Montgomery County Medical Society. This is the first webinar in our 2020 Rapid Implementations series, which will address critical pieces of infrastructure that your practice may want to access during this time of unprecedented public health crisis with COVID-19 having a major impact on practices in our county, across the nation and worldwide. So a few housekeeping items before we do begin. This call is going to be recorded, so please be aware that it will be posted online later this week. We have muted all participants at the beginning of this call for sound quality purposes. So if you'd like to unmute yourself and then remute yourself again after you ask a question, it is *6. On PC, you can hit Alt-A, and on Mac, you can hit Shift-Command-A, or you can navigate to the black bar at the bottom of your screen. It's the same on the app as well. It's at the bottom of your screen there. We do welcome your questions, so feel free to submit them via the chat feature throughout the webinar. We will start at the top of the chat and move through to the bottom, and then we'll move to audio calls. So the format of this presentation, we're going to open with Tim Hilton, who is a business development executive for PEAKE Technology Partners. He helps with all sorts of telehealth implementations as well as larger IT needs for medical practices. That's what they specialize in. And then following that, we'll have a Q&A facilitated with Tim Hilton and then also Allie Clark, who is an industry analyst and content manager for SimpleVisit, a telehealth platform that's offered by PEAKE. So we're going to go ahead and begin the webinar now. Thank you for joining us, and I'll go ahead and turn it over to Tim now.
Okay, thank you very much. I'm going to share my screen here and get everything started. All right, first of all, I do want to thank MCMS for hosting this. It is definitely an unprecedented time that we're living in right now. So there's a lot of need for the education. So like Carissa said, we are PEAKE Technology Partners. We are an IT management company that specializes in healthcare practices. So we service about 70 practices up all over the country, about 300 different locations. And we provide them with IT support, infrastructure management. We also develop their plan for their IT to grow and also help them implement new technologies and new softwares. So today we're going to be talking about telemedicine. We're also going to go through how to utilize telemedicine, how to build your telemedicine program, and some different options for telemedicine that are out there. There are over 275 different telemedicine providers at this point. We're going to only focus on 4 today, but I think they're a good 4. So, like I said, PEAKE is a medical-focused IT management company. We have EMR experts on staff, and we're experienced with dozens of different medical software programs. We have staff in the office 24/7, ready to help with technical issues for our medical customers. And we're very proud to be servicing our medical customers at this time and making sure that they don't have any downtime and that they're able to serve their patients. So telemedicine, what is telemedicine? Telemedicine is the remote delivery of healthcare services and clinical information using telecommunications technology. There's a lot to unpack with that. How are you going to reimburse? How are you going to bill? And the technology that you need. So reimbursement's gotten a lot easier, and we're going to answer a lot of that in the Q&A. The easy thing to say here is that I can't tell you exactly how reimbursement's going to work, just because I'd have to tell you how each individual practice would have to do it with their EMR and with the different payers, and we just don't have time for that. So what's going to happen is we're going to send out an email after this. Carissa will, and it's going to have a ton of different resources for you to research the different codes that you're going to need to reimburse, and the different payers that are now reimbursing fully for telemedicine, and how everything's working since COVID-19 has occurred. The restrictions have been lifted quite a bit. Billing, all the different telemedicine softwares are going to do billing a little bit differently. Some won't touch it at all, and some will. So once again, that's going to be kind of a hard question to answer, but I'm going to cover that for the options that we're presenting. We're going to discuss that a little bit. Technology is something that we can definitely speak to a decent amount today, and that's something that I think really needs to be thought of by any practice that's looking to introduce telemedicine. What you need to really think about is your infrastructure. Right now, you're used to having your practice not have too much in the way of video conferencing or streaming of video. That's very data intensive work. Right now, your infrastructure and IT infrastructure is probably built not to handle that kind of data transference. So before you really look at your telemedicine program, you need to take a look at what your infrastructure is actually able to handle. You have your networking gear, you have your internet from your internet service provider, then you also have your hardware that you're going to need to take a look at. What I would recommend first and foremost is really have a conversation with your IT team, whether that's outsourced or it's part of your team. Sit down and discuss with them what the implications are going to be from that hardware standpoint, because that you don't want to implement a new telemedicine program and then get everything set up and you're paying for a monthly service charge for it and you find out you can't even use it. That's worst case scenario. So once you have everything implemented, and we're going to go through how to implement in a minute here, how could you possibly use virtual visits? There's a lot of different ways you can use it. We have teleconsulting, you can do medication management, triage, counseling, you can do follow-ups, addiction treatment, report sharing, and behavioral health. There are some things you can't do with telemedicine. Right off the bat, and for a lot of you, this is going to be true, you're not going to be able to really do vital signs very easily. And there are ways to do it, but since we're all doing this so rapidly and implementing telemedicine so rapidly, you're not really going to have the hardware in place to do it. There are ways to do vital signs and temperature monitoring, et cetera, and you'll be able to implement those a little bit later. But what we're going to try and do is tailor this more towards practices that are trying to implement this quickly and easily. So for now, that's not something that's going to be really possible right off the bat. So when we're launching a telemedicine program, we like to put these 7 steps in place. With the current crisis, that's not always going to be exactly how we want it. There's going to be some of these that are a little shorter than we would necessarily prefer to occur. But I do still think all of these are valuable for reasons that I'll go into. So the first is a use case. It is very important for your practice to take a look at how you're going to use telemedicine, not just say, look, we're going to implement this telemedicine and go for it, see all your patients. Really think about long-term how you're going to use this telemedicine, because this crisis will eventually abate. And we want to make sure that when you've implemented this telemedicine program, that it is good for the long haul. I've worked with a lot of medical practices. Once a vendor is decided on, it is not the easiest thing in the world for practices to now then switch to a new vendor. So making sure that your use case is warranted is very important. So from there, your stakeholders, taking a look at who your stakeholders are is extremely important, because it's going to help you determine what kind of telemedicine program you implement. What I mean by that is varying telemedicine programs require varying amounts of technological expertise. So when I say stakeholders, I'm not just talking about patients, I'm also talking about your providers. So your patients, knowing your patient base, if they are pretty young and mostly in technological fields, let's say you are, servicing really the Rockville area and there's a lot of tech firms around there, then you're probably fine really just picking whatever telemedicine program you want. But if you take a look at your patients and you see, look, I have a lot of elderly as my patients that are not necessarily the most tech savvy people, you want to choose a telemedicine program that's going to fit that need. Uh, Similarly, if you have providers that are not necessarily the most tech savvy, you want to pick a telemedicine program that's going to make it easy on them rather than some telemedicine programs that might need them to be a little more tech savvy and help your patients through any tech issues or handle tech issues themselves. Um, the next thing you're going to want to do is establish your workflow. I can't overstate how important this is, especially now. We're in a time of crisis. People are trying to put it together and put in place these programs very quickly. It is extremely important to make sure that you have a workflow built out and set up before you put in your telemedicine program, making sure that you know what you're doing, you know what you're going to use your telemedicine program for and how you're going to implement it. The next is technology. I sort of touched on this earlier, but making sure that you have the hardware in place for this telemedicine program to be successful is extremely important. What kind of hardware are we looking at? It's going to be your networking gear, your security gear, and then your personal computers and what you're going to be using to actually have those video visits. So your networking gear, those are your routers and switches. If you probably have a tech room somewhere in your office. And if you go in there, there's a lot of blinking lights and there's this big thing that has a ton of plugs plugged into it. That is your switch. You might even have multiple, depending on if your EMR is based on-prem. Making sure that router has enough bandwidth and is new enough to handle the data amounts that are going to be coming through is extremely important. We at PEAKE really like the Cisco Meraki line. That's what we recommend for all of our practices. The next is making sure your firewalls are ready, making sure that they're new. There's a ton of different variety out there. You can have Barracuda, WatchGuard, Cisco makes firewalls as well. Making sure that it's ready to handle the amount of data and provide the security that you need is extremely important. So make sure that you have a discussion with whoever's doing your network infrastructure management for you about that, because it really, going from whatever you're doing on a day-to-day basis to having 20 to 30 or 10 or even 5 doctors having all different telemedicine conferences going all at once is going to be a massive drain on and tax on those resources. Then if you add in the fact that you probably are having some of your staff work remotely and need to access data that's stored on-prem or on your cloud and running through there, it's going to tax it even more. So really have a deep dive talk with your IT company to make sure that you are ready from a hardware perspective for this change. The easy part is your personal computer, making sure that you have a webcam. Turns out that's pretty important for telemedicine. Making sure that you have that, making sure that it's ready to go, making sure you have a good headset. Those kinds of things are the easy things, but there are things that a lot of times seem to slip through the cracks. I work as a business development person, so communications are my lifeblood. That's what I do on a daily basis. I can't tell you the market difference having a good headset makes when doing webinars like this or having conversations with customers makes. It is a huge difference, but those are the types of things that you really need to think about. The next thing we recommend is a pilot. Usually, we like pilots to last a little while. It's not feasible in this current crisis. It's just not. But we still think they're valuable, especially for all of the providers to go through and do some test cases. Actually test it out. Um, Make sure that they're comfortable with the technology. That's extremely important. The next step is promoting. Make sure that your patients know that this is an option. It doesn't do a lot of good to do all this work and implement it, and then have your patients not know that they can still come see you through telemedicine. Kind of, you're going to lose out a lot of revenue, and there's also the fact that um, yeah, they're going to go without care, and that's the worst possible scenario. Uh, the next is to assimilate. It is going to be a learning curve, making sure that you're bringing everything together and making it all gel and getting everybody on the same page. It's a process. It's going to take time, and especially since it's going to be implemented so quickly, making sure that you take the time to properly bring everything together, change the workflow as necessary is extremely important. So let's cover a couple different options. So we're going to go over 4 here today, and they're all a little different. They have different pros and cons with them, and we'll go over them. The first is going to be Zoom. So Zoom is a video conferencing platform. In fact, you're using it right now, and they have a healthcare product. There's a lot of pros with that. First of all, Zoom's very experienced. They're very good at what they do. They are one of my preferred ways to communicate with people when I'm doing webinars. And their price isn't terrible. They're pretty average. They average $2,400 a year to start, and that's not too bad, to be honest. And I believe that they do some discounts as you get higher and higher with more providers. There are some downsides to Zoom. The first is that both parties need to have Zoom. That is a downside in a lot of cases. The Zoom iPhone app, for example, isn't the greatest thing in the world. It's not terrible, but it's not great. And it also means that that person needs to be familiar with Zoom and has to download the app and has to have it on their phone or on their laptop and be ready to go. That's kind of can be a downside, especially for people who are not very tech savvy. The next is Dr. First. So Dr. First is very good. They're kind of a light EMR PM system with a telehealth add-on. To add on the telehealth option, if you're already using the Dr. First suite of applications, is $300. And I believe they're actually doing a 1-month trial for free because of COVID-19. So they have an app when you upgrade, and it has chatting and calling through that app. So the upside is that if you're already on Dr. First, that's a very cheap option, and it's much more robust than the next one we're going to talk about, Doxy.me, which is one of the cheaper options as well. The obvious downside is that you have to have the whole suite of things, which if you're utilizing it is great, and if you're not, it's not great. The next is Doxy.me. It's a browser-based platform, and one of the upsides of that is its price. If you are a single provider, they have a free option, and that's great. So some downsides with that is it's browser-based. I'm not a huge fan of browser-based video anything, really. And I especially am not a huge fan of sending video over the browser. That said, they do have a premium version, which is once again browser-based, but it does add in a lot of extra features that the free version does not. And if you're more than one provider, you do have to you can't use the free version. You have to go through and up it. The free version, it starts at, I think, $30, and then it goes up a significant amount, about the same amount per user that you add. That said, it's even in the premium version, it is browser based, which kind of rules out mobile devices. While they do advertise that you can do it on iOS and Android, I don't like doing that on mobile devices. I don't like doing anything browser based, especially video chat, if I can avoid it. So that is still a downside, even with their premium versions. The next option is SimpleVisit. That allows you to use any video platform. So what do we mean by that? It means that you can call, your patient can have FaceTime and you can have Skype, and SimpleTime is going to bridge that together for you. This makes it super easy for the patient, super easy for the provider. Not only that, you're getting a live receptionist who's going to call the patient, make sure that they're good, solve any technical issues. Then they're going to call the provider, same thing, and then they're going to introduce them both and bridge the call and drop. Obviously, they're not going to listen because of HIPAA reasons. So this option is definitely great for your practices that are dealing with not so tech savvy people, and also practices that want to have that receptionist feel. Make it feel like they're still coming to the doctor's office, and having that kind of special attention. SimpleVisit's price is $150 a month per provider. And yes, there are discounts for larger practices. Once you get into a certain range, you start going down to about $75 per user. And some resources. So I've dumped a lot of information on you, and I've only scratched the surface. So there is a lot of information out there that's available for you to take a look at. SimpleVisit.com/resources has a ton of information. We're going to be sending out some of that. AmericanTelemed.org is a great resource. One of my favorites is the CCHPCA.org. You're able to search by state. Some of you might service people in Virginia, West Virginia, and Pennsylvania. This site will allow you to search by state and see how reimbursement works, what legislation is in place, and how billing can work for those different states. We obviously can't get into that just because in the interest of time, it would just take way too long to go through each state and how it works. But that's a great resource. And that's it. So I'm going to hand it back to Carissa to take over.
All right, thank you so much, Tim. So now we're going to start our Q&A portion. So I will begin with what is already in the chat section. Please feel free to add your questions as we go there. And then after we've gotten through all of the chat listed questions, we'll move over to folks who want to do it via audio on their phone. The first question that we have asks, what are the IT issues if a physician is working from home?
So if a physician is working from home, there's a few. First of all, you need to really take a look at your home internet. Usually it's fine. If it's only you at home that's really going to be working from home, maybe you have a spouse and having a kid playing on the Xbox, you're fine. You're probably going to be fine with your normal internet. The issue is going to be at your practice. You need to take a look at how many people are working remotely, how many providers are working remotely, because you are going to be running any EMR-based work that you're doing. If it's on-prem, you're going to have to be going through your network and having your VPN set up, which is a whole other thing that we can talk about some other time. And you're going to have to be going in through your network. That's going to put a tax on what you're doing. So making sure that your practice is ready for that is important. Now, as far as the different telemedicine solutions, if any of the telemedicine solutions are having you host the data, that's going to be a problem. Just because you're going to have to go to your server, and then it's going to bounce out from there to somewhere else. More than likely, that shouldn't be happening too often. I think there's only a couple left out there that do that. But that is possibly a solution, or possibly a problem. Other than that, working remote, As far as telemedicine, really should not be too much of an issue as long as you can keep the cats and dogs quiet. I don't know if you heard my cat a second ago, but she came in here. Those are some of the issues. But for the most part, working remote in terms of telemedicine really should not be too much of an issue.
All right, our next question asks if all of the platforms mentioned on this webinar are HIPAA compliant and if they all provide BAAs as part of their setup.
Every one that we discussed today is HIPAA compliant. That said, you need to make sure that you're getting the Zoom healthcare specific solution because Zoom has their normal one, which is we're on now, and that is not HIPAA compliant. So when you're going to Zoom, make sure that you are choosing the healthcare specific option. As far as BAAs, I am not sure exactly which ones do and which ones don't. I'm not sure if Allie can speak to that. She might take a second to answer. So
Yeah, I know that SimpleVisit does. I think Doctors First does along with the EMR if you're buying the whole suite. I'm not sure about the Zoom. I do know that that's usually standard for when you do a HIPAA compliant thing. So I would assume that the Zoom healthcare, the reason that it's different than the regular Zoom is because of that BAA agreement.
Okay, and I assume that regardless, all potential practices that are looking to set up telemedicine should look to make sure that a BAA is part of setup for their own legal
Absolutely.
protection.
Absolutely.
Okay, great. So our next question asks if you have any experience or knowledge of Cron Health. This practice has Athena and Chiron Health, and they have integration built in through Athena.
So I do not. Allie might. That said, SimpleVisit also has Athena. So I can tell you from the SimpleVisit point of view what they integrate with. So Athena automatically pushes the scheduling out, which is great, and then it also gets pushed to Athena the total time of the visit, which is very important. Unfortunately, I don't have much experience with Chiron. Allie, do you?
I don't have experience with Chiron itself. I do know that it is a much larger company, so it's not just telemedicine that's a part of it, but it does have a bunch of different resources. Of course, that's going to make it more expensive as well. So it's just a matter of what features you're looking for.
All right, our next question asks, what is the concern with using a phone for a browser-based platform like Doxy.me? Is it a security issue or quality of video streaming? And if they do choose to go with SimpleVisit, does the setup have to be done through PEAKE Technology?
So I'm going to answer part of it, and then I'll hand the rest to Allie. PEAKE Technology does not have to do any setup with SimpleVisit at all. We're pretty separate. And as far as browser-based video, so I'll give you my personal experience, and then I'll let Allie, sort of talk about it as well. So functionally, browser-based video tends to not work as well. There's a lot that goes on in the background with that. It's not necessarily as secure, in my experience, as other video platforms. And personally, I don't like the interfaces that are usually available on browser. I don't like doing video in browser usually. I'd much rather have it in app where it's much more elegantly done is how I want to say it, but that sounds wrong. But Allie, do you have anything else to add?
Yeah, so with SimpleVisit, we use, again, we bridge the common video conferencing apps. So that includes browser-based like Meet or like Google Hangouts. Google Hangouts and Meet do have an app with the phone as well, a mobile app. And honestly, it's about quality. Again, Tim can speak to the security portion, but it really is about quality. If you're trying to do something browser-based, that's a video on a mobile device, it's not going to work the way that you want it to work in order to be able to see your patient and hear them clearly. As with an app, you have to allow the permissions for your microphone and for your video camera, but once that's done, it's always going to work the same every time. Versus browsers, ones often have to do with like, okay, is your Wi-Fi connected correctly? And is the camera going to be facing the right way? It's going to work differently when it's a browser-based video service than if it's an app that already is built to work with your camera on your phone.
Okay, great. Our next question asks, are the vendors listed as part of this presentation? Do they all allow multiple staff users if there's only one provider associated with the care provided?
So I want to make sure that I'm answering the right question there. Is the question whether or not PAs and MAs are allowed to utilize the service, or is the question if I register one user, can multiple different people utilize that account?
I believe it's more that if, say, you're a solo physician, can you have administrative staff log in to do setup and other work associated with the account?
I obviously can't speak to how Zoom or some of the other platforms are going to do it. To be honest, that would be I think it would be okay, as long as they're not actually going out and doing the visits, etc. At that point, you'd be kind of flying under the radar, as it were. But I think if it's just administratively, that should be okay, and should be fine.
Okay. The next question asks if all products touched on during this presentation archive the encounter in case of a future audit.
I'm going to let Allie touch that one as far as SimpleVisit first.
So I can answer for SimpleVisit, which is that we have a record of the call being made, but we do not record any of those calls or collect any private personal health information because of the limits of our BEAA and the way that the legal everything works. We don't store the health information of your patients. We only have an archive as far as the number of calls that have been made and to which provider accounts.
With Zoom, I can say that they do this that same thing where they'll keep a record that it occurred and for how long it took, but they will not record it without both their dual consent. So that's something you would have to do there, and that might
That's
change
going to
with their
be
healthcare.
across the board. And
Yeah.
if you're interested in a service that records it, it's going to be a different agreement than just a standard BAA because it has to be a healthcare licensed business rather than just a telemedicine vendor.
Right.
Are there additional recommendations for record keeping with regard to these visits that you would underline that practices should note before they roll out telemedicine?
I'll take that one really quick. Consent on file before your appointment is the number one record keeping legal that's important. You need to make sure you have assigned consent from your patient. Outside of that, making sure that, as far as record keeping, I'm not sure if this is the complete direction of the question, but I know just from personal experience in coordinating these calls as well, is that you need to make sure you have the proper patient contact information, because if you're wanting to, especially in the climate that we're at now, all of your appointments, you're going to be looking at moving to telemedicine appointments as much as possible. And if you don't have the proper contact information for the patient, however it is, or they don't have the proper directions in how to sign on to your telemedicine appointment, you're going to get backed up really quickly with your patients and with your appointments, and you'll be losing revenue, and your patients will be missing appointments.
Okay, our next question is from Dr. Dawn Broderick. She asks this question because Chiron does offer this feature. Do you know if any of the vendors require the patient to enter credit card information before the session can proceed? So it's sort of a upfront collection of co-payment, it appears.
I'll be honest, I do not know. I don't believe SimpleVisit does that, and I'm pretty sure neither does Zoom or Doxy.me. And I'm almost positive Dr. First doesn't. But Allie, is that something you have experience with at all?
SimpleVisit does not. Right now, we've suspended collecting co-payments because of the amount of appointments that have been there and because also the changing requirements with reimbursement from various payers. Their Doctors First, since it is integrated with the EMR, I'm fairly certain that they don't collect it up front. Most of those services that do are external ones that allow you to see a provider that is not in, like the one that you normally see, so like American Well and Teladoc and things like that.
Right. And that's my experience as well.
Yeah, I only asked that question because I saw it as kind of a additional step for the patients that was going to be difficult for them to do. So I didn't really see why that was required for them.
It probably is just to make sure that co-pays get collected. We're not experienced with Chiron as unfortunately to speak to it, but just that's what it would seem like to me.
But in general, collecting copays right now in the current climate is going to be difficult. So, I mean, I would agree that trying to eliminate that step for your patients when there's so much uncertainty around finances in the world, as well as for your, you know, your reimbursement and your billing specialist would be a good step and a good thing to consider when you're considering which one to go with.
All right, we're now going to move over to taking questions from folks who are just dialed in through their phone. So if you would like to ask a question, you can unmute yourself by pressing *6 and share your question with us this evening.
I have a question. Can I ask you about the waivers? Do you require, or do you think it's a good idea to get a waiver on every session or every tele session? Because, or do you just need it once per patient?
That would be for me. So right now, unfortunately, with the waiver, all of this information is coming. I mean, the update for the bill that was actually, the waiver that was passed was just yesterday, 2 days ago, 1135 waiver from Medicare, or from the Secretary of Health and Human Services for Medicare. And we haven't seen any guidance right now from CMS on exactly what the process for the waiver submission is going to be. I would assume that by the end of this week, we should have hopefully a little bit more clarification onto how to use those waivers. I'm thinking that it's going to be by provider per practice. That's just kind of looking at what it's the trend across the board. And also just knowing the amount, the burden of work that it would take to have a waiver for every appointment or for every patient. I'm hoping that CMS sees that as well, and I think that they will. You know, they've encouraged everything under their purview to open up the flexibilities. And in the information that we send out, I'm sure we can include the expanded information from CMS for Medicare and fee-for-service, Medicare Advantage and fee-for-service as well. Does that answer your question? Somewhat?
Yes, thank you.
Hi, this is Natasha Hers. I had a question in that I'm an ophthalmologist, and I'm not sure exactly how I might be able to utilize telemedicine, but I thought it would still be good to learn about. What kind of documentation would you do, or that, you know, to qualify for a billable telemedicine event? Like how much time, and I mean, how do you record all of that?
So again, going through each code is going to be difficult, but I mean, as I'm sure you know, the codes are all time-based. So the majority of the codes that you're going to be using, by and large, are the same codes that you use for a regular doctor's visit. So if those codes are within the set that is accepted by your payer for telehealth visits, you just would be attaching a modifier or a place of service code, or whatever it is that that specific payer requires for telemedicine visits. As far as whatever documentation that you are doing in your office for the length of time for a visit, when that code requires that length of time, is the same documentation you're going to want to do for telemedicine visits. So the start of call and the end of call, outside of, and how much face time with the provider. But the majority of the codes that you're using that have time limits on them are the same ones that you're going to be using. So you would really want to just document them the same way.
I also had read something that the American Academy of Ophthalmology sent out to us, just saying that we had to confirm patient identity, confirm that they, what their date of birth is, that you have to, document all of that when you get on the phone call with them. And then also, whatever encounter that you were having with them on the phone could not be related to anything that had just happened, that you had just seen them in office for in the last 7 days, and it could not result in a visit with you in the next 24 hours. Otherwise, it wouldn't be billable.
So those requirements definitely have to do with your payer restrictions. So it depends on which payers you're talking about. You have Medicare, you have Medicare Advantage plans, you have Medicaid plans, you have, and some of those Medicaid managed care plans are going to cover more than others. Your private insurer plans, TRICARE, and VA benefits, all of those are going to cover things differently, and they're going to all have different restrictions onto when and how you can use telemedicine. So those types of restrictions are going to be specific for your payer. As far as knowing who the patient is, yes, you need to be able to verify that. If you've seen the patient before, if there's already a pre-established patient relationship, then that shouldn't be a problem. The ability to see a patient via telemedicine when you don't have a face-to-face already pre-established patient relationship has now started to be opened up, even prior to the current crisis. But that is evolving on how that should be documented. I know at SimpleVisit, the information that we are getting from the patients or from the offices as far as the patient contact are all things that have been confirmed by their office schedulers. So it's on the scheduler, the receptionist, to make sure that the information that we've got is confirmed. And then the doctor themselves, if they've seen the patient before.
Okay. And I also read that if they are not they don't live in the same state that I am licensed in, that could be a problem too. I mean, I have people that drive from Virginia and DC to see me. I'm not licensed in Virginia and DC. I know the governor, at least for Maryland, said that was going to be okay if somebody that was not licensed in Maryland was doing it, but I don't know about the other way around.
Yeah,
like if
I can speak
Maryland
to that.
and Virginia.
Yeah, I can speak to that. So licensing, with this new waiver, with the 1135 waiver from the Secretary of Health and Human Services, they've suspended those requirements for licensing right now. That being said, just in general across the country, as long as the provider so the waiver itself says the waiver is for requirements that physicians or other healthcare professionals hold licenses in the state in which they provide services if they have an equivalent license from another state. The CMS has not issued any guidance on how this is going to be implemented. And I also want to caution you that this outbreak is going to end. And they've really opened up a ton of licensing and reimbursement requirement restrictions and kind of done away with all of that for this time being, but know that they are going to end. And as soon as, we kind of get back to the new normal, however long that takes, all of that stuff is going to be back. So you're going to want to at least be thinking about what your plan is after all of this. For specifically DC, the tri-state area, Maryland, DC, and Virginia, they actually have an agreement with licensing, which is that you can see patients in those states. but all of the licensing are different. There's also the Interstate Medical Licensing Compact, that there are a lot of different states that have joined to it recently. And I'm hoping that even on the end of all of the COVID-19 outbreak, telemedicine stuff, that more providers are going to really see the use for telemedicine, and more states and legislators are going to see it as well, and they'll start kind of jumping on board with those licensing compacts. I hope that helps.
Yes. Thank you. Yes, thank you.
All right, our next question comes from the chat box. It asks, since restrictions have been lifted during these unprecedented times, would a plain phone call count as telemedicine service as long as check-in and documentation is provided?
So no, I wouldn't be counting as a telemedicine service. Can you still do it? Yes. Whether you're going to be reimbursed by it, that's going to be another question. You know, CMS has given guidance that you can do things by phone and by home, and you can allow audio calls, but how much they're going to reimburse for it is, I mean, it's not going to be the same. And if, again, this goes back to your technology. So if you find it more convenient to be able to do an audio only phone call, then being able to choose a telemedicine service that allows you to use your phone with a conferencing app that you're used to using, so it's really not that much harder for you in a workflow sense for you to do a video conferencing, and you might be able to get reimbursed more for that than if it was just an audio visit call, is something to take into consideration.
All right, our next question is from Mary Lou Coy. She asks, how long is the implementation process start to finish? It's crunch time right now. So how long is it going to take to get up and running once a vendor is chosen?
I'll take this first, and then Allie can chime in afterwards with SimpleVisit. So there's a lot that goes into that decision. Like Allie just alluded to, eventually this crisis is going to end. So you want to make sure that you're choosing a vendor that is going to fit in the long term, and making sure that you have a solution in place. Making sure that you also have the hardware in place and have the technology in place to implement the solution is extremely vital as well. That could take a little bit of time. And making sure that you do the research as well is important. Let's say that everything was perfect, and you had all the correct technology and you found the perfect vendor for the long term. With SimpleVisit, at least, we are onboarding in about 48 hours-ish to bring somebody on board. And Zoom is about the same amount of time frame. And Doxy.me, I believe, is actually a little quicker. Doctor First, I can't speak to, unfortunately, as far as a time frame for how long it takes for them to implement you and bring you on board for the telemedicine side of things. But Allie, did you have anything to add there?
I have a couple. One thing is, have patience with your telemedicine vendors. This is uncharted territory for us too. And it's been, I mean, it's what I was saying to someone on a sales call the other day, which is that, you know, before this, we were trying to convince providers that telemedicine was worth it. And now we can't sign them up fast enough. So we're really, you know, trying to pivot as quickly as possible and get our workflows and our own processes up to the speed that it needs to be able to support all of these providers to care for their patients in this time. But have patience. And then the other thing, that speed and onboarding, the more you have prepared, the more you have organized and ready for your vendor, the better. I know that the length of time that for us when we've been onboarding people has been stretched, and it's not going to be just, you know, SimpleVisit, it's going to be any vendor. When it has stretched, it has been because they didn't have the correct provider video information. We've had to call back and forth. The providers hadn't, you know, tried their, you know, for us, because we can use FaceTime, we can use Skype, we can even use Zoom, we can use Hangouts and all of that. They didn't know what they wanted to use or how to use it. And so then there was kind of a length of time before they could create those first appointments, because they hadn't kind of done that homework on their end. So I would just say, make sure that you are prepared with all the information that you need.
Just to piggyback on that as well, just to make it understood. For example, Zoom isn't just healthcare. Every company in this country and across the world, for the most part, is looking at remote solutions. So what Allie said goes doubly for any company that this is a healthcare solution for their video platform. Zoom is growing absolutely exponentially. So I definitely recommend patients with any of the different solutions that you take a look at, and also be understanding that for some of them, you might have some video call issues, and that's going to be for in your personal life and in your in when seeing patients. Just in general, video conferencing is exploding right now, as you can imagine.
All right, so just a reminder to our folks who are dialed in via the phone, you can unmute yourself to ask a question by hitting *6. The next question that we have is a question about a listing to see what payers cover telemedicine and in what formats. That is a resource that we'll be developing and sending out after this webinar, so we will definitely get back to you with a comprehensive listing on that.
And then really quickly on that, Carissa.
Yeah, of course.
I just want to caution about that is that all of the private payer companies are going to pay something different in different states. So while we can, I'm sure we'll give you as the most that we can, and Chris does a great job with it. But every private payer company is going to do something different, even within the tri-state area. So making sure that you follow up with your insurance companies that you are contracted with and asking them once you have that list of codes from us what they are paying for those is going to be helpful.
You mentioned, you mentioned Medicare. How about Medicaid or MCOs? Are they also going to permit telemedicine?
So yes, Medicaid has opened up that to some degree. Maryland actually just passed a thing allowing a much expanded telehealth benefits, and we can include that as well. They are rapidly trying to pivot themselves and open up. Maryland before this, in the home, only patients who are hard of hearing could have telemedicine in the home. And now they've started to really open that up with the legislation that was passed a couple of days ago. But it's going to continue to vary. CCHP, which I know Tim mentioned as well, is a really great resource. They are the National Telehealth Policy Resource Center, and they have all of that, as well as I'm sure that will be included in what we send out after the call.
As a side note to what Allie just said, Medicaid ACOs are also included in that expansion. And we do have some information on that from MedChi, the State Medical Society. So we'll include those resources as well. Obviously, the situation is still developing in terms of what payers are offering benefits and for what period of time, et cetera. So we will send you the most recent information that we have, and then any questions that you have that are specific to your specialty, please do feel free to send them in response to the resources we send out, and we'll get you an answer on them.
All right, thank you. And regarding the consent, I know you said you've written a written consent, but if the patient cannot come in or the guardian cannot come in or they cannot have access to a fax, can we do a telephone consent like we used to do in the past? And then the last question is Skype for Business, if we can use that for telemedicine, if that's permitted.
So there are ways that you can do consent online. There are a couple of different formats of the ability to do that. You can, if you have the ability to sign things digitally. So I know some of the Adobe programs have that. I was just looking for another resource that I had about that.
You could also do it on an iPhone. You can edit a document and sign it that way, I believe. I'm not.
Yeah, so digital signatures are acceptable for consent. In some forms, you might need to have a unique identifier of some sort, but if you can verify that you're sending that consent to the right person, then that should be enough. Again, another useful legal resource for things like that would be CTEL, the Center for Telehealth and eHealth Law. And they have a lot of resources as far as, and they're a good kind of place to call if you have questions about those more legal questions. The second question that you asked, I was not able to hear. Did you mind repeating it?
Oh, so I was actually referring to when you ask for consent over the phone instead of like, because in the past in the hospital, we were allowed to get verbal consent over the phone. But I was wondering if we could do that with telemedicine, or it has to be a written, like an email or something, because email is not that secure either.
So the latest guidance from CTEL, the resource I was speaking to you about, was that you have a signed consent form, whether it's digitally signed or not, because you are going to be virtual, you're not going to be in person. You know, with a lot of those hospital online, or I mean on the phone verbal consents, it's because you have a patient there in your hands that you need something with right away, but you're never going to see this patient, or you might not see them for a week or a month, and so having that consent signed is going to protect you, even if it's just an online form.
Okay, like an email is permitted, then they could email their form.
Yes. As far as I know, yes. But again, I would check with both your medical malpractice team if you have a legal team there, or you can call CTEL or your Telehealth Resource Center is another great resource for that.
CTEL, S-T-E-Health? You said CTEL?
CEEL.
CEEL?
It is C as in cat, T as in Tom, E as in Edward, and L.
Okay. The last question was like, if we can use Skype for business, is that permitted for telemedicine, audio or video?
I can answer for SimpleVisit, which is that we do use Skype for Business to bridge to other people. The only thing I would say about Skype for Business is that it's actually going out of business and it's switching to Microsoft Teams. Microsoft has kind of absorbed Skype for Business and is turning into Microsoft Teams. So your Skype for Business is not going to work with some browsers and some integrations. Tim, do you know anything more about that?
So as of right now, it's okay for telemed, but like Allie just said, it is turning into Microsoft Teams. As somebody who does a whole lot of talking on different video and chat platforms, I would go ahead and steer clear of Microsoft Teams for the next 6 to 8 months, just because it's a disaster. That's just my personal opinion there. I have customers that are trying to use it for their entire telephony system, and needless to say, it's not going great. So I would steer clear from Microsoft Teams just for a little while.
On the video call side, I have personally connected people with Microsoft Teams to another platform. Patients rarely use it, but to Skype or whatever. And it works for what our providers use it for, which is just, a video visit without a lot of bells and whistles. But the providers who use it are also on an office desktop hardwired computer. So I don't know how it would work on a laptop or on a phone or in your home, because that's going to all change how your video conferencing tool works.
All right, so we will go ahead and close out this webinar to be sensitive to everyone's time. If you do have any questions that weren't covered on this webinar, please feel free to respond to the post-event email with any questions that you might have. There are a few items that I wanted to highlight really quickly before we do end the webinar. The first is that we will be sending out a one-pager from MedChi that does address recent executive orders and action taken by the Maryland General Assembly yesterday. So you will be receiving that shortly. One of the things that one-pager does highlight is the importance of having telemedicine covered as part of your liability insurance. We're working on developing more extensive information regarding telemedicine in collaboration with Medical Mutual, because the environment has changed dramatically over the last week or so. But please do take a look at that document and be sensitive to that as you're considering all of the different opportunities that your practice might have for telemedicine during this period of time. The second item is that MedChi did host a Q&A with Howard Haft, who is from the Maryland Department of Health. It was a COVID-19 specific Q&A session, and there were about 400 physicians across Maryland on the call. It was a really, really valuable session. And so if you are interested in listening to that webinar, it is streaming online on our website. So if you visit us at montgomerymedicine.org/COVID-19, you'll see that it's available, linked to on that webpage, as are a ton of other resources related to the virus. Our next webinar in this series will be held next Tuesday, which is March 24th, and we will address rapid implementation of remote patient monitoring, and we'll get into some of the nitty-gritty of billing for that sort of patient monitoring as well during that session, so keep an eye out for that. And then next Thursday, we'll be doing a session on employment law as relates to this period of time. Obviously, some practices are seeing dramatically lower patient volumes. Some practices are switching over to telemedicine as much as possible. And then a lot of primary care practices are seeing a real crush of people through. So we'll go through all of the relevant employment law issues. We'll have an attorney on the call to talk to us about those concerns. And then finally, I wanted to mention that MCMS just yesterday launched a Facebook group for physicians. We are validating that every single physician who does join our private group is a licensed physician in Maryland. Anyone is welcome to join. So please visit us on Facebook. Our page is Montgomery County Medical Society. We would love to have you participate. It's a great way to privately be back and forth with other physicians in Maryland about what they're seeing in their practices during this period of time. So please do consider joining us for that, and we'll make sure to include a link to that in our post-event email as well. And I just received a notification that our employment law webinar might be moved up. So, please hold on that date, but definitely next Tuesday, March 24th will be the remote patient monitoring webinar. So with that, I will let all of you go. I just want to say thank you so much for your participation, and please do let us know if there are any other ways that we can be supporting your practice during this period of time. Thanks, everybody.
Thank you very much.